I'll talk about the Heads Up campaign and how that works, because it's targeted at men particularly, and it's called Heads Up, Heads Together. It's Prince William's mental health initiative. And what we've been trying to do is remember that we are, as men, not most forthcoming. We're not people who want to talk about mental health. But actually, what you've seen from the campaign is the advocacy of leading figures. You know, some of the top football players, football managers in the country, top CEOs, business people who've achieved great things, but who were saying, well, actually, you know, I've suffered with mental health, or I'm still suffering with mental health. I'm still being treated. I'm having support. But you know what? Look what I've achieved. Look what I can achieve. And look how important it is that I dealt with this mental health area so I could get to where I wanted to be. So what we've done is we've partnered up with Crisis, which is a free text line. And of course, we're all on our phones, we're mostly texting. And they've got a lovely number, 85258. It's a free 24/7 service. All you do is text them saying, I need some help, I'm not coping. Anonymously, they will respond to you, they will talk you through it, they will message you, respond to your messages. So you can really talk about whatever you feel. And how you're suffering and what's going on in your mind. And sometimes we think, you know, I need to only talk about feeling low, or I need to feel about anxious or sleep, or there's something not quite right. It doesn't matter what you're feeling or what you think you need to say to them. Just tell them. They're happy to hear, and they're here as a sounding board. And the great thing is it's free and anonymous, of course, and it's texting, so you don't have to call, you don't have to show your face. There is, of course, another really great resource which I utilize a lot, which is the Samaritans. And they've got a 24/7 call line, which I really like using, because sometimes we don't want to text. Sometimes we want to pick up the phone to someone anonymously and say, well, look, I'm really struggling at the moment. You know, can I talk to someone? Can I get this off my chest? And sometimes we don't find it easy to talk to our friends and colleagues, even though we've talked about how, you know, it's normal to feel this way and we're all together. Sometimes we just want to speak to someone who's outside of our circle. That's okay as well. The most important thing is to start and have that conversation. So the Samaritans have got a free call line as well, 24/7 access. So you've got the text or the call, and they're really great resources. But of course, there are so many other resources that I want to talk about as well. I mean, there's two elements. We talked about how we can support others. We talked about asking twice, and we talked about not worrying about diagnosing the problem, but actually just reaching out and realizing something's not right and helping that other person to communicate that. But of course, how can we help ourselves? And I think the first part of that is, if you're listening to this and some of it's resonated and you're worried or thinking that perhaps I'm in this situation, just take a pause and ask yourself, am I okay? Am I struggling? Are there things that are different today? Has my sleep changed? Has my mood changed? Or am I more irritable? Men often don't say they're feeling low, but they say I'm more irritable. Or my concentration isn't what it once was. Or I used to really enjoy doing this activity or that activity. I don't really find enjoyment in it. If any of those things resonate, perhaps you are struggling with mental health at the moment. And I think that's when we come in and we say, look, we are here for you all the time. Your primary care, your GP is keen and absolutely ready to talk about your mental health whenever you want to talk about it. And again, you don't have to be the diagnoser. You don't have to have all the answers. All you have to say is, I think something's not quite right. I think this is a bit strange. This isn't me. I don't feel normal. I don't feel myself. And there are so many things we can do from there. First of all, we can just be there as a sounding board. We can talk about it. We can discuss it. Perhaps if there is a crossover and we think there may be a physical element, we'll do some investigations, or we may do some blood tests. If it turns out to be that we think it's more mental, we'll discuss that with you. We'll provide ourselves as a resource to check in regularly. Of course, there's free talking therapy. Wherever you are in the country, if you type in Let's Talk Therapy, it's a free online resource. You can self-refer, so you type in how you're feeling, how your mood is, and there's a few questions that direct you, and you just need to say whatever is in your heart. And a therapist will come in and call you normally within 7 to 10 days and have a discussion and talk about how they can help and set up some sessions for you. If, of course, you say, well, things are more serious, I think that actually my mood is much lower and this is really impacting my life, then, we may think about medication. And of course, your GP is not going to bring you in and say, right, here you are, you have to have medication, this is what's happening. We have a discussion, we talk about the options, and ultimately we leave the option with you about whether you want to have medication. And as I've talked about previously, and I would just very quickly address that the medication is there to support you, it's there to help you get back to a level of functioning that's normal, and then often we come off the medication. It's not addictive, it's not going to turn you into a zombie, all of these things are not true, and people have real amazing success stories with it. So I've seen personally. So those are the elements. And then, of course, if it is more serious, if it's something that actually suggests that there are elements that we need more help, we will talk to you as patients, say, well, I think this is a little bit out of my expertise. I think it might be worth us getting psychiatry involved. I think it might be worth us speaking to the secondary care colleagues. And of course, that doesn't mean that you're going to be sectioned or put in hospital or anything. It means that we want to give you the absolute best resource and help we can. And the secondary care team have got a whole huge team that can really support you with different elements. And we think that this would be something that will be beneficial for you. Of course, we may ask and suggest some self-help things. Often, because as we've discussed, as Carol mentioned, it's a normal reaction to an abnormal situation, but it's an abnormal situation that's affected all of us. So we may say, well, actually, here's some areas of self-help that you can do yourself. So there's some really great charities that I always advocate. There's mind.org.uk and there's mentalhealth.org.uk that have a fantastic plethora of resources of self-help. And within that, there's things like how our diet can help, how low-level movement, so walking a bit or just getting our bodies moving and pumping that circulation a little bit can help, how journaling or practicing gratitude or innovative techniques like tapping or mindfulness can really help us, and things that we can take into our life, be in control of, do ourselves, and actually really, really benefit our mental health. So there's a lot of amazing resources available. And of course, the most important thing is to say they're all free, they're all accessible, and you just need to reach out for them.